Is Mental Health Awareness Month, and many organizations in southern Arizona are using the exposure to advocate for more access to help. 13 News reporter Sean Mahoney has more on this growing issue. And Sean, what do mental health resources look like in our area?
Yeah, well, that's the question, Dan. According to Mental Health America, Arizona has the third highest rate of mental illness among adults, so the demand is there. However, the state ranks fourth worst in access to resources. Advocates here in Tucson say without a clear direction, many could continue to fall through the cracks.
They had all these different appointments that you had to start out with, but you never got to the actual treatment, and by the time you did, it seemed like the therapist either left or something was wrong with their schedule.
April Barbosa suffered from PTSD after her teen daughter was killed in Tucson in 2018. She says finding adequate resources, though, was a challenge.
Every organization that I tried to go to for treatment, where they had packed schedules, or they didn't take my insurance.
According to Mental Health America, there's only one provider for every 660 patients in need in Arizona. That can cause headaches for those trying to find help.
It's hard to get into places when you have so many hoops you have to go through, and and eventually you just get tired.
Especially when dealing with a mental health episode.
And when you're dealing with your mental illness at the same time, and you're maybe possibly not thinking clearly, that's going to be overwhelming.
Arizona had a $25 million grant for mental health and over $1 billion poured into behavioral health resources in 2023, according to the Substance Abuse and Mental Health Services Administration. But advocates say the direction of these resources needs to be better focused.
A lot of these social issues that we face in the community could be addressed by more quality behavioral health services.
Felix says too many resources without a clear direction could prevent people from getting the help they need, which 63% of people in Arizona do not get, according to Mental Health America. But that's where NAMI steps in.
So here at NAMI, we have an advocacy department where you can call in and get that type of information of how you can get connected with resources throughout southern Arizona.
But even those with NAMI say there needs to be more of a focus on quality programs and access to resources for all.
We need more funding for everything, for therapy, for, there has to be more funding, more cultural competency, compassion trainings.
Now to talk about some of the resources that are in place. There are places like crisis response centers in Tucson, many of which sponsored by local hospitals like Banner Health. However, advocates with NAMI say using the resources for some blanket solutions won't solve the problem, as well as directed resources like more education and training for therapists. Reporting live in studio, Sean Mahoney, 13 News.